My name is DeAnn Berry. I am the director of the critical care unit. I have been a nurse for 18 years and I'm from Benton County. So far with this virus, it attacks people differently. There are some people that have been diagnosed with COVID-19 that are asymptomatic, that are carriers. There are some people that get diagnosed and they do well for the first 5 to 10 days and then they immediately become very sick to the point where they can't control their symptoms and they are admitted to the hospital, and then as it progresses, they end up on the ventilator. The patients that we have had here in our facility have been on the ventilator for over 10 days. Depending on the patient's criticality, obviously the patients that we have had in the unit have needed life support. We have had multiple patients that have come to the unit that have needed ventilation, and they have been on the ventilator for quite some time. It's a very demanding role. The nurses are spending the majority of their time in the patient's room with dealing with their IV pumps and the medications that they need to be treated. They spend a lot of time trying to take care of themselves with their PPE. It is a very high-risk environment, so they're doing everything they can to stay safe, which is exhausting in a 12-hour shift. Our team works 12 hours, and just making sure that they don't contaminate themselves adds to the exhaustion of taking care of such sick patients. Just the isolation of not only the patient's family members, but the isolation as we as staff have to deal with on a daily basis. We have members of the critical care team that are going home and separating themselves from their mothers, their fathers, their children, their grandchildren. And so it is just a very emotional road at this point in time. I would say that one of the most important things that we could do as a community and as individuals is to comply with the rules and the regulations that are coming down from the state and the government, also local people, because you don't know who you may infect. You could be a person that is walking around with the virus that's one of those that are asymptomatic, and you could cause somebody else to become very ill who may not respond to the virus as easy as you did. So at this point in time, I think it's important for us to understand that it's not just about us as individuals, but it's about those that you could infect. One of the most proud moments that I have seen in going on our 5th week of COVID-19 patients here at Henry County Medical Center is the dedication and the loyalty of the team. I've had multiple text messages and phone calls from CCU staff members that are willing to work extra shifts because these patients are so very sick and they're demanding. So our typical nurse to patient ratio is not realistic at this moment in time. These patients are requiring a lot of work, a lot of attention. So I'm very proud to know that even though the team knows that they are being put at risk, it has not shied them one bit from stepping up and taking care of their duties. I'm very proud of their loyalty. I'm very proud of their courage and their strength. And I'm also very proud of the respiratory team because they're right there with us. So I can't highlight that enough. I'm very proud of their courage and their dedication to the facility and to their patients. We have worked collaboratively with a very large multidisciplinary team. We have included obviously the physicians, respiratory, CRNAs, we've included bedside nurses, directors of other departments, because at this point we are trying to prepare as much as we possibly can for what may come. I know there has been a lot of education and a lot of work in regards to the procedures that need to be done. One of the highest risk procedures that we see in our area is the intubation and the extubation of the patient. There has been a lot of training that has been going on for that. There's been multiple meetings. There's been training that has been posted online. I think the facility has done a great job in posting information in one localized area so that anybody in the organization can click on that link and find information about COVID-19. So I'm very proud of the collaborative efforts of the facility.